Hi, this is Dr. Raji Gopal, and I'm going to be talking about rhinoplasty surgery. I actually do a lot of rhinoplasty surgery, and I enjoy doing that. One of the most important characteristics for me when I do rhinoplasty surgery is to really create a nose that goes with the patient's face and with their ethnic background. A cute turned-up nose may not look cute in a different kind of facial frame or a different kind of ethnic background. So it's really important not only to look at the nose by itself, but to look at the nose with the rest of the face and to get maybe a little history of where the patient is from. And of course, very important is also to find out what the patient actually wants, because you want to really deliver as much as the patient wants. And so in rhinoplasty, it's very important for the patients to understand what can be done and what cannot be done, so that they have expectations that are realistic. So initially, during the initial consultation, other than me examining the nose, we have an in-depth conversation as to what can be accomplished, how much of the nose can be changed, and during a second consultation, I do have patients bring in pictures that they like and dislike, so I have an idea of what really the patient wants. And that again helps me determine my final surgical treatment for the patient. Generally, most patients come in either because their nose is a little too big, or that they have a dorsal hump, or sometimes their tip isn't quite right. So we really kind of address all these issues during the rhinoplasty. Most of the time I use what's called an open rhinoplasty approach, where there's a small incision in the columellar area, and the rest of the incisions are inside the nose, and that incision actually heals really well. Occasionally I will use what's a closed rhinoplasty technique when I'm not doing much tip work. That means the tip is perfect and we're dealing with other issues. During a rhinoplasty surgery, I have patients, obviously the day of surgery they come in, and it's done as an outpatient procedure. The surgery itself takes anywhere between 2.5 to 3.5 hours, and I usually do them under complete anesthesia, so they're asleep. Once the surgery is done, they do go home the same day. And nearly all the time with the complete rhinoplasty, they'll have a splint on top of the nose to protect the newly shaped nose. Also, they have packing inside the nose. Usually the packing will last for 48 hours. We see the patient back in 48 hours and remove the packing. That day they do need to have someone take them home, and the next time I see them is generally in 48 hours for us to remove the packing, and then after that I see them approximately a week after that, so about 10 days after surgery, to remove what's called the overlying splint. When the day the splint is removed, the patient can obviously see improvements in the nose, even though the nose is still swollen. So you kind of have to use a little imagination to see what the end result would be. Three-dimensionally, the nose is a little bigger, so it'll be smaller, more refined, things like that. But in about once the splint is removed, the patient can get back to normal daily activities, but still not exercise. And really, to start fully exercising, it really takes up to 6 weeks. At about 6 weeks, I usually tell patients that the nose is close to about 80% or so final result. And the last 20% can take 6 months to 1 year, depending on how much surgery was done, how thick the patient's skin is, and generally how fast the patient heals. But generally, in about 1 year, healing is complete, and not very many changes occur after that.